How you doing? I'm Marvin.
I'm Thomas,
I'm Dean.
and we're about to discuss, can blood flow restricted training increase muscle size and strength? Blood flow restricted training increase muscle size and strength. Well, why is it being studied in literature right now? There's a growing need to rehabilitate patients faster so that they can return to work or play. There's a growing need to increase performance in athletes, and there's a growing need to slow the degenerative effects of aging on muscle mass. What is low-intensity blood flow restricted training, otherwise known as LI-BFRT? It's a form of resistance training that involves occluding the limbs of the legs and the arms with an inflatable device or a band elastic device, and it allows arterial blood flow while restricting venous blood return. This method is coupled with low-intensity resistance training, which is usually around 20 to 30% of 1 RM. This venous blood pulling allows metabolic byproduct to accumulate while also causing muscle fibers to fatigue at a much faster rate. Breaking the norms a little, while traditional resistance training methods yield results in both strength and size, there's a growing movement that shows results can be produced using a protocol that appeals to a broader population, from competitive athlete to rehab patient to the elderly population. Can blood flow restricted training increase muscular size and strength? Imagine being able to increase size and strength without the use of heavy loads or complicated movements. Current literature suggests that there are positive effects on strength, there are positive effects on hypertrophy, and the use of LI-BFRT can be used with a wide population in different areas of the fitness experience spectrum.
Alright, I'm going to be talking about how blood flow restriction training leads to increases in muscular strength. We look at different strength techniques to develop our overall strength and maintain it, and blood flow restriction is a great training style that has been often overlooked. Adding different variables to a training routine can ensure that an individual does not hit a plateau. The goal is to make any training session productive and improve overall strength. One study showed an increase in strength usually associated with muscle hypertrophy in both men and women. Initial reports suggest that positive effects on strength after blood flow restriction training session. The result is an increase in strength gains overall. HepChem 2015. Muscular strength continued. BFR gives an individual an option to train with low intensity to achieve a different level of anabolic muscle strength. BFR isn't a replacement for heavy training and overload. It is an accessory training method and should be done on days where the motivation for heavy training just isn't there. Think about a time during the week when you're not as motivated for heavy compound movements, such as barbell squats. Blood flow restriction gives the alternative option to achieve similar strength gains by using 20 to 30% of 1 MR compared to 70%. The workout will have similar effects of heavy strength day compared to a high intensity training. It is recommended that blood flow restriction be performed every other day. 2 to 3 days of blood flow restriction per week is best for strength and muscle. Muscular strength continued. Another study took 20 semi-professional rugby athletes and were randomized for lower body blood flow restriction. Occlusion training can improve the strength training gains in experienced athletes. This is clear improvement in bench press results from lower body occlusion training suggests a systematic effect of blood flow restriction training. Cook. The training style they implemented in the study, it was performed 3 times a week for 3 weeks and incorporated 5 sets of 5 repetitions in the bench press, the leg squat, and the pull-ups performed. The results were as followed, and they proved that athletes who compete at such a high level need a new stimulus and to overcome the plateau. So blood flow restriction training helps athletes achieve an even higher level of strength and pushing through that plateau.
Low-intensity blood flow restricted training leads to muscle hypertrophy. It was once thought that the only way to see an improvement in muscle size would require an individual to lift heavy loads to induce the appropriate pathophysiological response associated with muscle hypertrophy. Traditional loads used to induce muscle hypertrophy are greater than 65% of your 1RM. Various rest lengths, time under tension, and repetitions have been tested to see what works best. The results vary depending on factors such as the subject's age, gender, fitness experience level, and health of the individual, but often the end result is hypertrophy if the subject can perform at the intensity required, which is often higher. Now, a study by Alexandro was recently conducted and revealed both high-intensity resistance training and low-intensity blood flow restricted training seem equally effective in increasing muscle mass. We now have proof that you can increase muscle size with low loads just under a set of different conditions. Can you imagine a circumstance in which you or someone you know may want to maintain or increase muscular size without having to lift heavier loads? We have data that shows postmenopausal women have seen an increase in total bone-free body lean mass as well as muscle thickness. Imagine the ability to be able to increase lean mass in postmenopausal women, considering postmenopausal women experience a decrease in estrogen, resulting in a decrease in lean muscle mass over time. Sakamaki showed us that the gender difference in the training responses is non-existent in untrained men and women, and both groups experienced an increase in muscle hypertrophy in the blood-restricted arm that they were testing, whereas there was no change in the non-restricted arm when performing bicep curls once a day for 6 days. The evidence is clear. LI-BFRT training increases the size of the muscle with loads as low as 30% of 1RM when blood is occluded. LI-BFRT training can be an alternative to lifting heavy loads to sustain muscle size or stimulate muscle hypertrophy.
Although stimulating muscle hypertrophy is an important factor of blood flow restriction training, it is also important to know that BFRT works throughout a wide population. As you age, it is necessary, but not always easy to work on your strength by staying active and being healthy. Some problems that we face as we get older is muscle strength, size, mobilization, and coordination. Dividing the wide population into 3 sections, we have the young male and female athletes, ages 16 to early 30 years old. 2, postmenopausal women, ages 55 to 66 years old. And 3, elderlies, ages 60 years old and older. The young male and female athletes. Throughout the young male and female athlete population, blood flow restriction and occlusion training is recommended for them because in their early years, their body's growing and their bones become stronger. There was a study tested throughout a 4-week trial in the healthy male and female athletes. Used BFR training doing leg extensions with light weight, more reps, 3 days out of a week, exerting 30% intensity and 80% strength. The result at the end of the 4-week trial showed a 20% increase in strength without making a change in the nerve or vascular functions. Does it work for young adults? Yes, it does. And are there any risks of injuries? There's always a risk of injuries if there's improper form. 2, postmenopausal women. There are some common concerns of postmenopausal women with the onset of osteopenia. Osteopenia is when you have low bone mass that can lead to osteoporosis. Now, osteoporosis is when bones become fragile and have a huge risk of bone fractures. There was a study where 16 postmenopausal women were divided into a high-intensity elastic band group or a low-intensity elastic band group, including blood flow restriction. Each group performed seated chest press, seated rows, and seated shoulder presses on for 3 times a week for 8 weeks, and it showed various improvements. Each workout increased their 1MR or RM by 1 to 2%, and in total, their upper body increased by 4%. Now for 3, elderly and over. Weight training exercises are not suitable for them because their body gets weaker, their eating habits change, and their muscles get smaller. It's possible for elderly people to gain bigger and stronger muscles without even lifting heavy weights. There was a study tested where there were 23 64-year-old participants divided into 3 different groups on a 12-week program. The groups were heavy resistance training group, the blood flow restriction group lifting in only 20 to 30% of the weight of their max, and BFR group using the restriction of blocking off 50% arterial blood flow restriction. BFR has the most increase in muscle size throughout the test, which was the result of it. And what happens if the elderly had a busted knee, if they got hurt, what would they do to recover? If an elderly had a busted knee and knees recovery, he or she would go to a rehab facility. And as a PT, we could use the occlusion device and test to see how much weight the client can handle, as if he or she is using 65 or more of their 1RM. We have the client sit down on a PT table, and we wrap the blood occlusion device on the client's upper right thigh, making sure the band is not too tight, allowing venous blood return. We avoid creating any numbness or tingling. We determine how tight the band is on a scale of 1 to 10, 10 being extremely tight. And we want the client to feel that the strap is around a number 7 or below on the scale. The subject is doing 3 sets of 15 reps on doing seated knee extensions. We're getting the client's right leg to work twice as hard because of the restriction. We are fatiguing more of the client's type 2 muscle fibers, which will have more of the muscle building effects. The client receives all the benefits of working out, not having to lift heavy or do any intensity workouts.
All right, I'm going to be talking about some limitations. One big limitation to the studies conducted is that they have not included data that represents the tempo of the exercises, nor the range of motions were standardized. If these variables are not standardized, we may not be clear as to what factors specifically contributed to both muscular strength and size.
Another limitation is due to the small population being tested within each study. Larger populations are needed to increase the reliability of the studies to ensure that an increase in muscular strength and size is indeed an effect that occurs with the use of low-intense blood flow restricted training.
Conclusions. Low-intensity blood-restricted training has proven to increase strength and size in varying populations such as young male and female semi-professional athletes, postmenopausal women, and the elderly population. Low-intensity blood flow restricted training can be used for rehab as well as facilitating improvements in a sports and strength conditioning setting.
For future suggestions, LI-BFRT offers no greater risk than a high-intensity restriction training. When stress is appropriate, there are some considerations. A researcher named Clark found out that low-intensity blood flow restriction training did not alter nerve or vascular functions. But here are a few recommendations to consider before you start. Always consult with a physician first. Do not attempt if you have a heart disease, hypertension occurs, poor experience of cerebral hemorrhage or a stroke, blood coagulation problems. When using blood flow restriction devices, be sure to use one that measures the amount of restriction. Often, the use of recreational bands rely on recommended intensity of 7 on a discomfort scale of 1 to 10. However, it would be wise to consult with a trained professional and receive training to use devices that measure the amount of pressure being created.